Hey there and welcome. We all want our cats to live these long, happy, healthy lives. But the truth is, they face some pretty serious and often totally invisible health threats. So today, we're going to talk about how to build a kind of health shield for our feline friends by breaking down some of the most critical diseases and, most importantly, how we can protect them.
So, let me just start by asking you, when you think about your cat's health, what are the first things that pop into your head? The biggest risks? Well, in this explainer, we're going to tackle some of the most significant threats out there, from super contagious viruses to really common emergencies, and what you can actually do about them.
Okay, let's dive right in with our first major threat. This is a disease that's a perfect example of why prevention is, well, it's everything. It's called Feline Panleukopenia.
So what in the world is panleukopenia? It's a nasty parvovirus, and its whole mission is to find and destroy rapidly dividing cells. Now think about where those are in a cat's body. You've got the bone marrow, which is churning out all the immune cells, and you've got the lining of the intestines. So this virus hits on two fronts, which is what makes it so incredibly devastating, especially for little kittens. And that nickname, feline distemper? Kind of confusing, actually. It has absolutely nothing to do with the distemper virus that dogs can get.
And if you want to understand just how serious this is, wow, look at this number. This is the survival rate for cats that are actually hospitalized with this disease. Even with round-the-clock intensive vet care, the odds can be really, really tough. On top of that, the virus itself is incredibly hardy. It can survive in the environment for up to a year, just waiting.
But here is the most important thing you need to hear about panleukopenia. As deadly as it is almost entirely preventable. The core vaccines we have are just so effective. They provide this powerful, long-lasting immunity that's like a fortress against this disease. The takeaway here is simple. Vaccination is absolutely crucial.
All right, let's switch gears and move on to two very different viruses that are all about social interaction. To really get a handle on feline leukemia and feline immunodeficiency virus, you kind of have to understand a little bit about how cats behave with each other.
And you can really see the difference right here. Feline leukemia, or FeLV, that's the friendly cat virus. It spreads through close, prolonged contact. We're talking things like cats grooming each other or sharing food and water bowls. But feline immunodeficiency virus, or FIV, is totally different. It's almost always transmitted through deep, nasty bite wounds, the kind that happen during serious fights over territory. So you see, one is about closeness and the other is about conflict.
Now, FeLV is a retrovirus, which is a bit like a genetic sleeper agent. It literally inserts its own genetic material right into your cat's DNA. And once it's in there, it can just hide out, which can lead to a bunch of different outcomes and makes the infection pretty complex to figure out.
This chart shows the different paths an FeLV infection can take. So after a cat gets exposed, it's not just one outcome. Best case scenario, their immune system just kicks the virus out completely. Then there's what's called a regressive infection, where the virus is kind of kept in jail by the immune system, but it could cause problems later. And then the worst case is a progressive infection, where the virus just runs wild, and that leads to a much shorter life.
And because of all this complexity, diagnosing FeLV isn't always cut and dry. An initial positive test usually needs more follow-up, and even a negative test might need to be done again later. The bottom line is a single test doesn't always tell you the whole story, so working closely with your vet is just essential.
Okay, so let's talk about FIV. You might hear people call it feline AIDS, but it's a very, very slow-acting virus. A lot of cats with FIV live for years without showing any symptoms at all. It is definitely not a death sentence, and, this is important, it absolutely cannot be spread to people. There's no cure, so it's all about management. Good supportive care, treating any other infections that pop up, and keeping them inside to protect both them and other cats in the neighborhood.
All right, let's shift gears again. We're moving away from infectious diseases to something completely different, but just as critical. Feline lower urinary tract disease, or FLUTD. Now, this isn't one single disease. It's more like an umbrella term for a bunch of different problems that can cause a real crisis for cats and, honestly, for their owners, too.
These are the signs you absolutely have to know. If you see your cat straining in the litter box, or going in and out all the time but only peeing a tiny bit, or suddenly peeing in weird places, they are not being bad. They're almost always in pain and trying to tell you something is medically wrong. Seriously, paying attention to what's happening in the litter box is one of your most important jobs.
Now, under that FLUTD umbrella, this is the big one, a complete blockage. It's way more common in male cats just because of their anatomy. Their urethra is longer and narrower, so it's much easier for it to get plugged up with tiny stones or inflammation. And when a cat can't urinate, dangerous toxins start building up in their system, like right away.
And I want to be crystal clear about this. This is not an exaggeration. A blocked cat cannot wait until your vet opens in the morning. As the source material says, this can be fatal in less than 24 to 48 hours. A cat that is straining to pee and nothing is coming out is one of the single biggest emergencies in all of veterinary medicine.
So, after hearing about all these serious issues, what do? How do we actually build that health shield we talked about? Well, it really comes down to 5 key pillars of proactive care that tie together everything we've just discussed.
Let's just walk through them. Number 1, core vaccinations. That's your shield against killers like panleukopenia. 2, regular vet visits. Can't stress that enough for catching things early. 3, lifestyle management. Keeping your cat strictly indoors is the single best thing you can do to prevent them from getting into fights and getting FIV, or from the close contact that spreads FLV. 4, environmental enrichment. The most common cause of that urinary disease in young cats is actually stress, so a stimulating, fun environment reduces that stress. And finally, number 5, proactive observation. You knowing those signs of urinary trouble we just looked at, that is your first and best line of defense.
We've covered a lot today, right? From viruses to urinary blockages. But the common thread through all of it is that our knowledge and our actions, that's what forms the most powerful shield for our cats. You know the old saying that a cat has 9 lives? The real question is, how will you protect them?